Hey, everybody, welcome to the Athletic Potential Podcast. My name is Mike Matthews. I am your host, and today is episode 14. Today, we are going to cover rotator cuff tendinopathy. We are going to go over bench pressing for throwers. We are going to talk about working in a niche and testing the core. As a brief overview of each episode, we always start each episode with a case. It's typically the last patient I treated prior to the recording of this episode. Then we go to questions from the audience, and then we finish with a general takeaway and summary from the episode. So let's dive right in. We're going to start with the case. As a 21-year-old right-hand pitcher, collegiate pitcher, with some shoulder pain. What had happened is he's a pitcher and a position player, and he slid into a base, and he jammed up his shoulder and had some substantial pain to the point where he couldn't lift his arm. Upon initial examination, he had a lack of active range of motion of about 160 degrees. He was lacking about 20 degrees, and it was mainly due to pain. I could passively take him to almost full range of motion with minimal pain, so it indicated that it was potentially more of a tendon problem than anything else. He also was unable to throw following this event. It's his dominant side, his right-hand side that he injured. And so we did a few other tests, and what we found was that he most likely had a bit of an impaction or compression injury to his supraspinatus muscle, one of the rotator cuff muscles, mainly just because he jammed it between the bones in his shoulder and his shoulder blade and had some substantial pain that came along with it. Our initial goals for treatment were obviously to decrease his pain, to allow him to be able to move freely and be able to return just to basic reaching and daily activities without any pain. And that came back fairly quickly. The next goal for me was to getting him back to being able to swing a bat, because in the league that he's playing in, or was playing in currently, he was able to DH. And that way he didn't miss as much time as he would have if we had to wait for him to throw. So we had him, once his pain levels were down, I started working strength of the rotator cuff through stabilization, hands-on. We did use some blood flow restriction protocols with him as well, and we were able to get him back swinging about within about 4 days. To be honest, the only reason it took 4 days is because it was over a weekend. And so we saw him on a Friday and then saw him again on the next Monday. He was swinging about by Tuesday morning and was able to actually swing about with minimal to no pain. Throwing is another story. He was unable to demonstrate normal external rotation without substantial pain in his shoulder. And it took quite a while to get his range of motion back, meaning like in my case, for a long while for him was about 5 days. It took that entire next week to get external rotation to be completely back to about 150 degrees of external rotation without pain passively. When he did attempt to throw, his pain did return almost immediately. However, his pain levels were less, and it wasn't quite the same type of pain. It was more of a dull pain rather than a sharp pain. And so we continued working on rotator cuff strength and stabilization, as well as doing some modalities to improve the tissue quality of the tendon, specifically, like I said, one of the rotator cuff muscles. We used dry needling, we used electrical stimulation, and at one point we did use iontophoresis with dexamethasone to help decrease some of the irritability that he had in his shoulder. The update now is he's now able to throw 150 feet without pain, which allows him to go back to his position at third base and shortstop. We did opt to have him not pitch at this point and to think more of a long-term recovery to get him back to pitching. To date the podcast, we're in the middle of the summer, and at this point I didn't really want him to return to pitching as he has a whole fall to be able to progress back to throwing at this point. So I didn't have him do that. And so we got him back to hitting and throwing, and he's playing a position now with minimal to no pain. And we'll get him on a return to pitching program as soon as the summer season is over. And at that point, we will progress him back to the fall. He goes back to his college in the fall, and hopefully we'll be able to get him back to pitching in the fall, facing hitters and being 100% not only for the fall but also for the spring. So interesting case in regards to a traumatic rotator cuff injury. We don't typically see a lot of those, but it did present more of a traumatic, and it did take quite a bit of treatment to get the irritability in the tendon back down, and now he's back up to normal strength as well as good range of motion, and we should see a nice progression back to throwing from him. All right, that'll do it for the case. Now let's move on to question and answer, or questions from our audience. And if you, just as a note, if you do have questions for the podcast, I encourage you to go to the website, www.athletic-potential.com/podcast. There's a button that will say ask a question or submit a question. Go ahead and click that. You do not need to submit an email if you do not want to. However, I do encourage you to put an email address or some form of contact to get back in contact with you. More because if your answer requires more specific, if your question requires more of a specific answer, we want to make sure we answer that question for you. So we can't do that unless we have that contact information. You're not required to do it, but it's recommended. So appreciate that. Go to the website, submit a question so we can answer more everybody's questions. And let's dive right into our first question. So question 1 comes from Will, and he asks, what is your opinion on bench pressing for baseball players? I have heard that it's not good and can cause shoulder problems. Is this true? Well, Will, these topics usually are heavily debated, whether or not you should bench press or those type of things. So obviously all of my answers are predicated on this is my opinion, and based on my experience, and then I'll give you my mindset of why I think it may or may not be a good idea. And this is how I answer every question in regards to exercises. That I get questions like this all the time, right? It's not only bench pressing, but it's what are the other ones? Back squatting, chin-ups, overhead pressing, what's some other ones? There's other ones that are out there that I get questions all the time. Hey, should my athlete be doing this type of exercise? And I always answer with a similar format, and I'll try not to go on a rant or anything like that. But let's address your question about bench pressing. Do I think it's bench pressing or the pressing movement, and I like to categorize it as a horizontal press, so you're pushing forward. Do I consider that movement to be a bad movement for baseball players? And I think that's an easy answer of no. I think it's a great movement for baseball players. However, there are definitely better ways to do this movement than others. I can tell you right now, in our youth clients, nobody touches a weight until they can demonstrate 5 good, proper push-ups. It's a very specific push-up that we teach our youth athletes. They have to show good core positioning, good body positioning, and they have to show me that they can actually maintain shoulder and spine position throughout the entire push-up. This push-up is unique in that they are required to go all the way to the ground. Their chest hits the ground. They are entitled to release their hands. When they do it, they release their hands from the ground, then they put their hands back in position and then push up from that position. That ensures depth, but it also ensures that they're maintaining good core stability throughout. And they have to show me 5 of these push-ups before they're allowed to even get to a weight. And when we say weight, this is where I think you're getting with your question, and that is, do I believe barbell bench pressing is a good idea for baseball players? And my answer for that is I don't have any of my baseball, softball, or throwers barbell benching. I definitely have them doing dumbbell and kettlebell variations of a bench press, but I don't have them use a barbell. And the reason is because the bar will then dictate the path of movement in the shoulder, and I don't want that. Interesting quote by Mike Boyle, a strength coach out of Boston. He used to do strength conditioning for the Boston Red Sox for a couple of years, and one of the things that he said in a webinar was he had almost all of his pitchers bench pressing with dumbbells, and he said, but none of the pitchers actually looked the same. So each pitcher had a different variation or different shoulder position or different certain positions in their bench pressing movement. And he didn't coach that out of them. He just let it happen because, again, each of those pitchers has a very specific body type and body arm length and those type of things. And so when it comes down to answering your question, Will, I definitely want to make sure you understand, I don't have any of our guys bench press using a barbell. Even neutral grip barbells for me, I still don't like it because, again, the bar then dictates a little bit more of the shoulder path. I really like the idea of dumbbells and kettlebells for these athletes in regards to a bench press, because again, the shoulder can kind of more freely move in its more desirable pattern of movement, and as well as there's more stabilization that has to occur when you're using a dumbbell rather than a barbell. And so, do I think bench pressing for baseball players and pitchers and softball players is bad? No, but I definitely pick, per the individual athlete, the type of implement used when we do horizontal pressing or bench pressing or any of those movements. I can tell you this, that I don't start everybody with dumbbells or kettlebells. Almost all of our athletes start with a push-up first. I use it as a test as much as an exercise, and I typically will add load to the push-up after that in the form of either chains or a weighted vest. And then from there, I'll progress to a little bit more of an instability environment. It's about the only time I use a BOSU ball in the clinic now, or in the facility now, is when I'm doing push-ups, is a little bit of variation with the BOSU ball in regards to instability. And then once they can demonstrate good pushing skills that way, then I start introducing bench press variations from there. I definitely don't use a single version of a bench press with dumbbells and kettlebells. I like single arms. I really like working symmetry with these movements. One arm's holding while the other one's doing the movement. Sometimes I'll do totally off-weighted on one side. The other day we had one of our athletes doing a 45-pound kettlebell on the right side with nothing on the left side, and the amount of core work that person needed to do just to maintain body position was amazing. I thought it was exactly what that person needed. So, Will, this is a great question. This is again, the other thing I didn't bring up, and this is something I always bring up in regards to exercise selection for your athlete, is it really comes down to a risk-benefit ratio. So you have to ask the question, okay, what's the risks with this exercise? Bench pressing with a barbell has inherent risks, mainly for the reasons I just said. I think for baseball players is it fixates the path of movement in the shoulders, and with baseball and softball players, and even any type of thrower, volleyball, javelin throwers, those type of things, those shoulders become a big deal, in that if we force range of motion through those shoulders and create a problem because of using a barbell or any other implement that's kind of contraindicated for that athlete, we are kind of breaking rule number one of training, and that is you should never get hurt during training. And so I always want to look at it from a risk-benefit ratio, and I don't see a benefit beyond the risk using a barbell for baseball, softball throwers, or those type of athletes. And so it's a good question, Will. I'm sure we'll get more questions like this in regards to exercise selection and maybe why we like and we don't like them. I can tell you this, almost all of our baseball players, softball players, regardless of position, are bench pressing or horizontal pressing in some variation. We start all of our youth athletes with push-ups, and they have to demonstrate good push-up positions and control before they can even get a weight. And then those more seasoned athletes that have been through training more, we definitely will integrate more horizontal pressing in the form of a dumbbell or kettlebell, those type of things with them. So great question, Will. I hope that answers it. So we'll move on to our next question, which is question 2. This is from Kylie. Bit of a different question. We normally get questions about exercises and treatments and those type of things. Kylie is a physical therapist and asking more of a specific question to me, which is great. And it says, Kylie says, I'm a practicing physical therapist. You made mention previously that you used to work with a more general orthopedic population. What do you feel was the biggest change when you switched to working with more of a niche, however it's pronounced? So from my history, I graduated PT school and immediately worked in a general orthopedic outpatient physical therapy clinic, where I saw anybody from the ages of 5 to 95, and predominantly working on musculoskeletal injuries, post-op surgeries. I've seen a large amount of total shoulders, total knees, total hips, ACL reconstructions, obviously anything in the upper extremity. I saw a lot of rotator cuff repairs, a lot of general orthopedic patients, and again, ranging. And I'd say, to give you a little bit more of a background, Kylie, of where I spent most of my time, the first about 3 years, my average age of my patient was probably in the 40s, early 40s. I then switched to a new location, opened a new clinic, and I think it dropped a little bit to like maybe in the 30s. So I was treating predominantly 30-year-old individuals for orthopedic injuries and sports injuries. I then moved clinics again less than a year later, opened another clinic, and the age of our population went up quite a bit. So I was probably looking at late 40s, mid 40s at that point. And that's when I started to maybe grow into a little bit more of the throwing baseball population. I always saw a lot of baseball players, but that's when that part of my practice really started to increase to almost a quarter, or maybe even almost towards the end there, almost a third of my population was baseball players and softball players. And so that's kind of just general background. So I've seen a lot of different things. That was over the course of 10 years. And I left 10 years after that and opened Athletic Potential. So Kylie, to get back to your question of what do you feel, let's make sure I get this question right. What was the biggest change when you switched working with more of a niche? I left and started working more with the baseball population and the throwing population. And what I found was, the first thing is I thought I knew quite a bit, and I felt like I had a decent handle on what needed to be done in regards to rehabilitation at that point. However, I can tell you that once I went full dive into it, I learned a lot more, and I learned a lot of the little things that I really wasn't doing before, that I feel like pushed, I was getting my clients better a lot faster. I can tell you right now, I didn't use a lot of modalities when I was treating this general population of those clients. I just didn't use a lot. I used the basics, the heat, the stimulation. I guess I did use modalities, but I can tell you right now, I use them way more than I did previously, but I do it in conjunction with hands-on treatment. I can tell you right now, with a modality treatment, I almost typically do it, I have clients use it on their own time. I don't do it when I'm in clinic. The framework that I have right now is I'm one-on-one for each client for an hour. And if I have them doing electrical stimulation, it's usually, if I'm with them, I'm typically doing exercises with them for activation, or they're on dry needling, and we're using electrical stimulation for that. And obviously I'm more present with that. But a lot of times I'll hand I've got a couple electrical stimulation units that I hand out, and I put patients on protocols to go do them overnight, to 2 to 3 day protocols. I don't typically do a lot of modality work while the patients are with me, just because I feel like my time's better spent with hands-on exercise or control or manual therapy or anything like that. So I'd say that one of the biggest changes is that the overall methodology for me is, I came from a clinic where I didn't get to spend an hour with each client, just because of the nature and the framework and how the clinic was run, and that was just how that clinic was built, and it wasn't bad. It was great. It worked. We got a lot of people better. But the one-on-one has definitely changed my mentality in regards to how I spend time with my clients. So I think maybe just managing treatment is probably one of the biggest things I've noticed to change, is that I do a lot more hands-on, a lot more manual. I do a lot more movement training. I dive way deeper into things with clients. I do a lot more research reviews. Sorry, I'm kind of ranting a little bit, Kylie, but do you know one of the main things I've noticed, and nothing against the general orthopedic population of clients, is I can tell you that at one point when I was working with my general orthopedic clients, I gave them no more than 3 exercises for their home exercise program. And I felt the reason why I only gave them 3 is because adherence, I felt like, went down if I gave them more than 3. Now, there's subtle nuances. Some people would do everything I gave them, and some people would do nothing. No matter if I gave them one thing, they still wouldn't do it. But that's okay. But I can tell you right now, I would give 3 max. And I felt like that was our most adherent number, and so we had to really prioritize which exercises our clients were going to do when we only had 3. I can tell you right now, with my clients, I'm writing full-fledged programs where I'm basically writing strength and conditioning programs daily for each client. And I'm maybe have one client who doesn't fulfill that out of all of them. And that's the guy who is, he's working full time and he's trying to be an athlete on the side, and it's just hard for him to do it. But I can tell you, I hand out way more exercise programs now than I ever have. I write full-fledged strength conditioning programs, and my clients all fulfill them. And I think it's just because that's what they're here for. They're athletes. Their main goal is to make it to the next level, and so it's just much more of a priority. There's nothing against the general orthopedic clients. They just have lives. They're working 9 to 5. They have kids. They have other responsibilities and things that draw on their time. And so we had to prioritize down the exercises to make sure that they were doing at least the very basics that needed to be done. And so now I think that's a huge change. I definitely spend a lot of time on programming, which is great. And we see some substantial changes. I also don't spend a lot of time with exercise with my clients. When they're with me one-on-one, I go over their programs. I make sure they know the movements. We go over the basic movements. We make sure that they train well. And but I don't spend, I don't have them exercise in clinic with me for that hour. I don't have them do their exercise program. They do that after the time with me. And so that's been a big change. A lot of times we have our clients when I was in outpatient orthopedic clinic, we'd have them exercise while we were there with some exercise specialists or some personal trainers type, those kind of things. And that worked really well. The model was great. We got clients better. But this has been a big change. This is a good question, Kylie. I've really had to kind of think about it because it's become a little bit more of a normal thing for me now, being in the practice for as long as I have now, just over a year. But those changes were major. There's a couple other changes that were major as well, in regards to insurance and those type of things. So, Kylie, I hope that answers your question. I think the big thing is that I definitely had to change the entire way I treat it. My treatment format for each visit is a lot different. I definitely do a lot more evidence-based. I shouldn't say I didn't do evidence-based before. I absolutely did evidence-based, but the amount of depth of evidence review I do for each one of my clients is substantially more, which has been fantastic. And then, I think it's just up the level of the treatment that I've had to provide. I use more. I find it a little bit interesting that I use more modalities than I did before, but that's because I'm trying to treat tissues and getting ready to return to sport. There's more of a pressure, I would tell you. There's more pressure than there was originally to get these athletes back performing as quickly as possible. So, and we definitely work with professional athletes as well, and there's a lot of pressure there because there's money on the line and their careers are on the line, and I love that environment. I think it's fantastic. It's a good question, Kylie. I'll think about it, and I'm sure I'll come up with some other things, but great question. So let's move on to question 3. Jordan asked this question. It says, my question is in regard to your movement screen and whether that includes any testing of the core. Do you test the core, and if so, how? And when you say core, Jordan, I'm assuming you mean like abs, obliques, anything to do with the midsection, anything, and I'll lump in posture because that's how I think the best way to answer this for you is to kind of identify maybe how do we work posture and how do we work, we test for core strength, core endurance, those type of things. So Jordan, to answer your question, absolutely we test for the core. We do that in very specific ways. There's some pretty good research out there. Stuart McGill, again, a big back researcher out of Canada, he's published a few studies on this, but he's published a study on core endurance in 3 different positions, extension, side plank or like frontal plane, and then also in like abdominals, and you hold those positions for a certain time frame. You should be able to hold them for the established standards, which is, we definitely use that test. I modified that test a little bit because one, the positions are kind of tough to get into, and then there's quite a bit of setup on a few of them, but realistically it's a pretty simple test. But we definitely test core endurance, so their ability to hold position over time. So I definitely would say we test that. Side plank is something we test and retest all the time. I feel like that gives us a ton of data. This is anecdotal research, but I feel like we get a ton of information if our patients and clients can maintain a side plank position properly. And if they can't, then we notice that there's rotation problems. We know that there's shoulder stability problems. We obviously know that there's core endurance problems, maybe even activation of the hip problems. We know that that side plank position is one of the highest EMG activation positions for the glute medius, which is main hip abductor. And so I really like side planks. That's one of the main ones we test. All of our new clients coming in get a 2-minute plank test. I don't train planks beyond 30 seconds normally, but I do test for 2 minutes because I feel like it's a good measure of strength and a good measure of core endurance and the person's ability to be able to figure out their body in space. I got the 2-minute plank test from Dan John, and I tried it out and it was fantastic. I definitely think it gives us good information. So I test, let's see, a little more specific for you, Jordan, rather than kind of more rant and rave what we do. Our first initial core test is almost always the 2-minute plank test, whether that's a 8-year-old athlete or a 58-year-old athlete. We definitely do the 2-minute plank test. Almost all of our baseball players do a modified curl up for endurance test. It's usually something like, can you do 4 sets of 10 seconds with no rest in between and maintain proper position? We side plank test everybody, not necessarily initially, because sometimes we have to work on shoulder stability and those type of things, and obviously if you have pain, we need to avoid those positions. A side plank definitely can aggravate lower back pain pretty substantially. That's just, again, anecdotal experience for me. And so I would say 2-minute plank, side planks for time, typically like a minute to test on each side. We do a modified curl-up test, 4 sets for 10 seconds, no rest in between. They basically go up, hold for 10 seconds. At the end of the 10, they drop back down. They immediately come back up. If they're unable to maintain position, they're unable to get back into normal position, or we start seeing compensations from somewhere else in the body, then we consider that a poor test. I really like grading things on like a green, yellow, red scale, just because it's simple for the clients to understand. And so we kind of grade on that scale. But to answer your question about core testing, 2-minute plank, 1-minute side plank on each side, 4 times 10 seconds curl up test. And then for some of our athletes, we'll do a prone extension test. We basically have to put them in a glute ham machine and have them hold. I do the 4 for 10 seconds with that one as well. So yeah, I'd say that's kind of how we test our core. I wouldn't even say it's core strength. I definitely would say it's core endurance that we test more than anything else, because we need to make sure that core can maintain position as the body moves and produces forces other places, either throws a ball or kicks a ball or hits somebody, those type of things. So good question, Jordan. I hope that answers your question. If you had to do just one, which I don't believe in just doing one. I think there's plenty of tests and good tests that we can do, but if you had to do just one, and maybe you're a coach or something like that, always start with the 2-minute plank and see how your athletes do it. Remember, the plank is a fail the minute they are unable to maintain a straight line between their shoulders and their ankles. So if their midsection is sagging towards the floor, that's a fail. They need to keep a straight line the entire time. If they are unable to even obtain that position, then it's a fail, and we know that it's a core problem, and we now know that we need to work on core endurance. So good question, Jordan. I really appreciate it. So all right, let's see, no more questions. That's our last question for today. So as a general review and recap, question 1 was talking about bench pressing and whether it was good or not. The answer is I don't like barbell bench pressing for my throwing athletes. I do dumbbell bench and kettlebell bench and push-ups. And it's all about, anytime we're talking about exercises and whether they're good or bad, it's all about risk benefit ratio, specifically for that athlete. So make sure that there's a good benefit with the least amount of risk possible. Rule number 1, I mentioned Mike Boyle earlier, but this is something else that he's mentioned and I've taken to heart, is rule number 1 in training is that nobody gets hurt in training. Weight room is a safe place, never should be injured in training. And so that goes a lot into risk benefit. So question 2 talked about what's the difference between working general orthopedics and now that I'm in a niche,
I'd say the main difference is my treatment methodologies. I spend a lot more time working on tissues, and I work a lot more on movements, and I write enormous amounts of programs, more than I ever used to in the past, and all my clients follow them, which is great. So where the majority of our clients in the orthopedic, they follow theirs as well, but like I said before, we kept it to 3. That was good adherence. We saw great results. We see even better results now with these full-fledged programs, but that's probably one of the biggest differences as well. So, and then Jordan asked a question in regards to how do we test the core. 2-minute plank, 1-minute side plank, 4 times 10 seconds for a curl up. Those are the main things we use for core testing. So great questions. Always fun to talk about these things. I really appreciate everybody listening, taking the time to be on or to listen to the podcast. Again, if you do have questions for the podcast, www.athletic-potential.com/podcast. Click submit a question or ask a question. We'll make sure we answer any and all questions that we get. Please rate and review this podcast. Share it with your friends. We definitely want to give as much information out as we possibly can to help everybody achieve their full athletic potential. And that does it for this episode, and we'll get you next time. Thanks.